Sam Vaughn for Sam Sports Report. Today we're going to talk about whether medicine or TMS is better. Well, guess what? It depends on the person. Whether medicine or TMS is better depends on the person of the condition and being treated, how they respond to each treatment. Here is a comparison to help you understand why TMS is better for some and people than the medication, and also medication might be preferred. Why is TMS fewer side effects? TMS does not cause weight gain or sexual side effects or tiredness like many antidepressants do. Common TMS like scalp discomfort or headaches are usually mild and temporary. Non-symptomatic TMS worked stimulating a part of the brain. Magnets know nothing goes where blood on treatment affects her whole body. Non-symptomatic treatment. TMS works by part of brain magnets. Nothing goes into your bloodstream, affects your whole body. Effective TMS fails. TMS is often used when antidepressants don't work or have little called reaction or treatment resistant depression or allergic to or does not work. Non-invasive, the invasive habit, unlike some medications like benzodiazepine, long-term, some people have lasting improvements from TMS or easier access medications are easier to get often. Benefits of medicines over TMS. We just gave you the benefits of TMS over medicine. Medications easier to cover it off by insurance. You can take them at home. Faster starters. In some cases, medication can work quickly, and especially for anxiety, panic symptoms. In some cases, medication can move quickly, especially anxiety or panic of symptoms. More recent antidepressants have been around longer, are more widely known, so doctors are familiar with them. TMS is required to do a clinic 5 days a week for several weeks, which can be harder for some people. Side effects, delivery, use cases, convince, long-term effects, fewer mild magnetic stimulation, often after meds don't work, requires clinical visits, can be significant. Pills, whole body, usually first take it home, may not need long term. Benefits: FDA is approved for OCD, anxiety, mania, TMS worked usually fewer side effects. FDA approved OCD, anxiety, sometimes PTSD may help if medicines haven't worked or caused side effect. Usually fewer side effects, maybe just mild or scalp discomfort. Changes not approved for schizophrenia disorder or bipolar may depressive parts, but not only psychosis or mania. Expensive, takes on time for sessions for weeks, may not widely be available in your area. Schizoaffective disorder establishes a antipsychotic stabilizer, not forced choice. Bipolar disorder, mood stabilizer, antipsychotic. TMS can be risky if you're in a manic state. Anxiety, SSRI, TMS can help for that. PTSD, SSRI, TMS sometimes helps if meds don't work. Best combo for many people are medications, therapy, CBT, forced focus, anxiety. TMS is added if treatment is not working and meds are not helping. When right, depression, struggles with suicide, also not TMS. I have failed many medications, so I'm excited in some ways to try something different. I suffer from many side effects. I hope this works. Otherwise, a doctor and me are going to figure out something else. Sometimes I hope Mental problems will go away, but the truth is they will never go away.
Treatment-resistant depression is generally defined as depression that hasn't gotten better with trying 2 antidepressant medications. We know that after a person has tried 2 medications and has not improved, their chances of responding to a 3rd or 4th medication are much lower. We're excited to offer transcranial magnetic stimulation, or TMS for short. This is a non-invasive treatment that uses gentle pulses of magnetic energy to stimulate nerve cells in the brain. It works very differently than standard psychiatric medications, and it can work even when medications haven't been effective. When a patient comes in for TMS, they sit in a chair that looks a lot like a dentist's office chair, and we place a magnetic coil over a specific area of their brain. That magnetic coil generates gentle pulses of magnetic energy that will stimulate the nerve cells in that region of the brain. So when these gentle magnetic pulses reach the surface of the brain, they cause the nerve cells in the brain to fire and send a signal. What that does will depend on what part of the brain you're stimulating. For example, when we place the magnetic coil over the motor area of the brain and we send one of those pulses, we can send a signal from that nerve cell all the way down a patient's spinal cord, down the nerves in their arm, and cause movement in their hand. For depression, we're treating a different area of the brain that's involved in regulating attention, thinking, and behavior. TMS is also helping to rewire the connections between that area of the brain and deeper regions in the brain called the limbic system that are responsible for regulating mood. The treatment feels like a firm tapping on the head. Patients are awake and alert during treatment. They don't need any sedation or anesthesia. There's no recovery time. Patients can return to their normal activity immediately after treatment. The most common side effects are some discomfort at the treatment area and potentially mild headache after treatment.
How do you feel, Kate? Good.
TMS treatment usually lasts for about 20 minutes, and it takes place 5 days per week for about 6 weeks. The benefits can be long-lasting. For some people, the benefits last for a year or potentially much longer. But I will say that unfortunately, it's not a permanent cure. We just don't have a cure for depression yet, but TMS is a wonderful, long-lasting option.
Now on to baseball. The Royals led 3-1, and then the Royals bullpen blew it up. They had one of the worst games of the year. Lucas Erceg was not available last night. And he had tightness in the back. Royals pay for that. Steven Cruz, who has usually been good, got the last 2 outs in the 9th inning, but in the 8th inning he loaded the bases and walked 2. Bases were loaded with nobody out. Carlos Estevez got the strikeout, but he couldn't get the 6 outs, and in a double scored 3 of them to take the lead. And Tyler Clark wasn't very good. He hasn't really been good this year. I think his ERA was better than he actually is. He gave up 4 runs. One of them was a 3-run homer. That was a bad game to lose. The Royals lose 8-3. Today's game, Angel Zerpa got the first inning, and Jonathan Bowen has got the last 2. Franco Matas has been inconsistent this year, but is pitching pretty well right now. The score is 0-0. 4th inning, the Royals did squander a double with nobody out. Tomorrow's game, since we may not preview it, good time to preview it, will be the Mets Royals. Clay Combs will go for the Mets, and Noah Cameron will go for the Royals. Cameron pitched really well last game. He won 3-0 over the Tampa Bay Rays. Game time 12:10. The Cardinals lost to a bad Braves team 6-5 last night. Score was 7-6 today. Braves go for a series sweep over the Cardinals. That would be a surprise. Sonny Gray goes for the Cardinals, and the Braves have undecided for the start tomorrow at 1:15. The Cubs get jolted last night, 11-0 against the Yankees, and responded well today with a 5-2 win. Tomorrow will be the rubber match. Shota Imega will go for the Cubs. He's pitched well. He won 8-1 over the Twins in his last game. He'll go for the Cubs. Will Warren will go for the Yankees. Tomorrow's game is at 12:35 and 1:35 Eastern from New York. This is Sam Vaughn for Sam Sports Report.